All right, we've talked about peristalsis, we've talked about osmosis. Now it's time to talk about constipation. It turns out that constipation is a problem of the large intestine. And most of the time, it's what we call functional constipation, which means that there's no pathophysiological explanation for the constipation. Having said that, there are some pathological things that can cause constipation, and that's why when you're interviewing someone with constipation, you may want to ask them about some red flag symptoms, such as blood in their stools. If it's bright red blood, we call that hematochezia. If it's dark tarry stools, representing digested blood, we call that melena. If you're worried about bowel cancer, you can also ask about constitutional symptoms, like fatigue or weight loss. If we're talking about functional constipation though, let's think about it in terms of those two processes, water movement and peristalsis. There are three things that probably affect the amount of water that eventually makes its way to your large intestine. And one of those things is how much water you ingest. But if you think back to when we talked about how much fluid goes through the whole system, you'll remember that on average only about 2 liters is ingested through the food and the drink that you consume. And 2 liters is just a fraction of the 9 liters that makes its way in and out of your intestines. So although oral ingestion of fluid is probably an important element of getting fluid to your large intestine, it may be not the most important. The second factor that will influence how much water makes its way to your large intestine will be the osmotic effect of what you consume. Now, in order for solutes to make its way all the way through the intestine and to remain in the lumen, it has to be undigestible. So when we talk about the osmotic effect holding on to water even into the large intestine, we should be thinking about undigestible sugars and other solutes. And the third factor that determines how much water makes its way into the large intestine is what we just talked about, and that's insoluble fiber that holds onto water like a sponge, creating soft bulk once it gets to the large intestine. So when we think of water movement and those three factors that influence how much water eventually makes it to the large intestine, we can imagine that a deficit in any one or a combination of those things can lead to constipation. For instance, a lack of oral intake of fluid could increase your chance of constipation. Similarly, a lack of insoluble fiber creating soft bulk in the large intestine could increase your chance of constipation. Now, when it comes to treating constipation, we'll talk about using these three factors to increase the amount of water and soft bulk that makes it to your large intestine. Now, the first line treatment for constipation is getting people to increase their daily intake of insoluble fiber. And the best way to do that, of course, is to eat foods that are high in insoluble fiber. And if you can combine that with the benefits of soluble fiber, then so much the better. And of course, often insoluble fiber and soluble fiber are together in the foods that we should be eating more of. For instance, fruits and vegetables and beans and legumes and whole grains. Now, of course, it makes sense if you're going to increase the insoluble fiber in your diet that you have the fluid that goes along with it. And that's why when we recommend an increase in insoluble fiber, we'll also recommend that people increase their daily intake of fluids. Now, the second line treatments for constipation take advantage of osmosis. By taking in undigestible solutes, such as lactulose or polyethylene glycol, you're making sure that those solutes stay in solution right into the large intestine, where by osmosis they hold onto water and tend to make your stools softer. Now, the third line treatment for constipation relies on stimulating peristalsis through the enteric nervous system. Two common medications used for this are Senokot and bisacodyl.